So, Dr. Lauren, thank you for coming on the show today. You've been in Kelowna about 3 years, West Kelowna. Mm-hmm. Tell us how you got here.
Yeah, so I actually moved up to the Okanagan pretty much 3 years ago, almost to the day. And I moved here from Vancouver. That's where I did my naturopathic medical school training. Before that, I did my undergrad in Calgary, but I'm also from a small town in Saskatchewan. So I kind of slowly moved west, but then I realized I wanted to go to a smaller center that kind of reminded me of home. And the Okanagan really does that for me because it has really great, dry, hot summers, minus the fires. Right. But it also has the 4 seasons, which I found really weird not having the 4 seasons in Vancouver. I really like the snow and I like skiing, but I also don't really enjoy minus 50 weather. So I found that this was a great spot to come. I actually live in Peachland, so it's a little bit smaller as well, but it's so nice in the central Okanagan because I feel like I can go north or south and I can really go anywhere within about 35-45 minutes, which is great. So yeah, I love it here.
Tell us a little bit about what it was like growing up in Saskatchewan and what point did you realize I need to get out of here?
You know what? I actually really love Saskatchewan. I do. And every time I go back to visit, I generally try to go in the summertime. We always go up to a place called Waskesiu in Prince Albert National Park. Right. If you have never been to Saskatchewan and you want to go to a really beautiful place that will probably dispel any sort of thoughts about what Saskatchewan is, go up to Waskesiu. Right. It is full of lakes and forest, and it's not kind of that classic prairie thought that I think everyone has. But I also actually do really love the prairies. There's something I find when I went back, it's like that open field, the open, huge, beautiful skies, and the absolute best sunsets that you can see. But at the same time, I did kind of want to go and explore other parts of Canada and see what else was out there, because growing up in a small town, it was great. It was a lot of fun. And I'm from Lumsden, so it's about 20 minutes outside of Regina. So we were still close to kind of the city, but Regina is definitely not as big of a city as obviously Calgary and Vancouver. So to be able to experience kind of living in those bigger cities and then get a better appreciation for how I did grow up in a smaller town and kind of wanted to move back to something that was a little less crazy and busy, I thought was important. So that's why I'm here.
Do you remember the time when you knew you were going to be a doctor?
Yeah, so I wanted to be a doctor at a very young age. So I had my appendix rupture when I was about 7.5. And obviously that ended up being emergency surgery. They said it was one of the worst cases of appendicitis that they had seen. And I was actually in the hospital for quite a while. I believe it was around a month or a month and a half. And for that type of a surgery at that time is quite a long time. And I had a lot of kind of post-surgical complications and infections, and I was quite sick. But I was so fascinated with being in the hospital. I absolutely loved it. I thought the surgeon and the doctors saved my life. I thought the nurses' jobs were so cool. And I had this huge appreciation and interest in the human body and in our medical system. And so since then, that was kind of what I worked towards. And that's what I did. I went to the University of Calgary. I was in biological sciences. I was in the whole pre-med. It was crazy, tons of work. And I was actually volunteering at the hospital there, the Foothills Hospital, for a program there, a day program for grade 9 students. And it was a preventative program. So it was called the Party Program. So it was prevent alcohol and risk-related trauma in youth. And they would come in and we'd talk about prevention of all of these things and how not to end up in the ER and the ICU. And we'd do tours through the different areas at the hospital. And that, along with some classes that I was taking through the kinesiology program at the university, kind of got me more interested in the preventative side of things. Like, why are these things actually happening? And why are people getting so sick? And why are we on so many medications? And through some of those experiences, I realized that medicine and our healthcare, what I thought it was so much different. Mm-hmm. And I really was more interested in kind of figuring out how we can prevent some of these things. And I think we need a blend of both, obviously. We need ERs, we need ICUs, we need both the conventional side and obviously the naturopathic medical side that I'm in, which is why I created an integrative health clinic in the first place. But I really did find that was more where my passion was. And in terms of kind of educating patients and taking a look at all aspects of the health was really important to me.
used to know a couple of medical students, and they told me it was like excruciatingly hard, like really long hours, a lot of studying. And tell me if this is true. I think you have to learn math first and then biology, and then you go into medical sciences from there. Tell us, like, just walk us through briefly how the process of becoming a doctor is.
Yeah, so when I went into undergrad, I was in biological sciences. So then to do kind of pre-med, at that point, you're taking all of your basic sciences. So I was in biology, chemistry, organic chemistry, physics, all the calculus, pretty much all you do. Yeah, you need all the math and all the physics as well, which, I loved kind of at the time in high school, but it was a little bit different in university, but I still got through it. So you need all of those basic sciences as well as biochemistry as well, and then some electives too. So usually either some psychology or some English courses as well. With naturopathic medicine specifically, you need a 4-year degree, so a university degree before entering the program. So that's where I got my biological sciences degree. And then I had all of the prerequisites that I had already needed to obviously enter naturopathic medical school. And then after that, naturopathic medical school is a 4-year degree as well. Wow. That we do. There's 2 accredited schools in Canada, one in New Westminster, in BC, obviously, and then one in Toronto. And then I think there's 6 or so in the States that are accredited after that. So altogether, I ended up going to school for, I think it was about 9.5 years post-secondary education. Yeah, long time.
And did you ever go through moments where you said, the workload is just too much and felt frustrated? And how did you get past that?
Yeah, I can remember actually, I was pretty much a straight A student in high school, and I was always striving to get good grades. I was kind of a perfectionist, type A. And when I got into first year of just my university degree, I remember, I think it was I started in September, and I think it was around maybe start of November, mid-November, I called my parents, and I was just in tears because it was overwhelming. It was just so much more work, and the class sizes were huge. I came from a really small town where I was in a class with maybe 25 other students, pretty much from kindergarten all the way up to grade 12. And when I was in university, some of my classes were up to 400 students. So, the support system was so changed, and I had moved to a different province, and then you're reestablishing living on your own and making new friends and taking care of yourself and all of these things on top of the fact that you're also in this highly competitive program where everyone is trying to get all of these, straight A's so that they can either get into med school, or they can get into naturopathic medical school, or they can get into veterinary school or dentistry, right? Because we're all basically taking the same courses at that time. So it's a very stressful environment. So it was a lot of support from family and a lot of support from friends, and also just realizing that it was okay not to be getting maybe my straight A's. It was okay to talk to people about that too, and kind of let some of that perfectionist go. It takes a long time to figure that out, but it was really leaning on support of the people around me, and also finding the supportive group on campus as well, where I could, find people to actually study with, and we could get through the midterms and the finals together was a lot easier. So it took a few terms through school to do that, but eventually you persevere and get through. But thinking back on it now, it's I don't know if I could do it again.
Well, that's a long time and a lot of work. So naturopathic medicine, has that always been a medical degree? Because I seem to remember, I'm quite a bit older than you, but I seem to remember when I was a kid, it was kind of like a fringe thing, and doctors didn't really respect it. Was it always a medical degree, or is that something fairly recent in our society?
Yeah, it's a good question. So when you look at naturopathic medicine, naturopathic doctors in BC are licensed primary care physicians. So we are protected underneath the Health Act of BC. We're licensed, we're regulated, we've got a college. There's lots of rules and things that we need to follow, and our scope of practice is quite big. And that keeps changing and expanding kind of year to year. Depending on the province that you live in, there are different regulations for naturopathic doctors, and some have been licensed licensed and regulated for a long time. I believe Saskatchewan was actually back in like 1955, I believe. And so some of the provinces, this profession has been around for quite a while. Other provinces, they're just now getting their regulations and getting things up and going. So across Canada, it's kind of hard to say. It definitely depends on the province that you're living in. BC is great because we actually have the biggest scope of practice. I would say Ontario is probably the next after that. When I take a look at it, when I entered university, I didn't even know what naturopathic medicine was. I come from a small town. There was one family doctor in that town, and that's what we knew. And it wasn't until I was in university and I started to kind of look more at the preventative aspects of things, and that's when I actually found some information on naturopathic medicine. And I actually went out and shadowed a few NDs in Calgary because I was like, what is this? I've never heard of this. But when I looked at the principles of the medicine and everything that was going on, it just made sense. And I was actually signed up to write my MCAT, which is the entrance exam to get into conventional medical school. And I canceled that about 2.5 weeks before I was supposed to write it. And I just knew that wasn't the way that I wanted to go. I'm pretty sure my family and friends thought I was nuts. But it wasn't, after spending that entire time studying for the exam, I was just like, I knew something more was out there for me. And I have great respect for the conventional side of things, and we need both. But for me, I really was more on that preventative aspect and taking a look at like, why are these things happening and how can we actually support the body in healing and doing that in a bit more of a natural way. Yeah. And that's where I ended up. So, right. Mm-hmm.
So tell us the basic differences between traditional medicine and naturopathic.
Yeah, so I guess when you look at our overall, conventional medicine and our healthcare, sometimes that can be looked at as a bit more of a reaction to, where people are waiting until they have symptoms and waiting until they're already sick and then seeking out the care. And then we're trying to figure out, okay, how can we stop those symptoms? And generally the first go-to is medications most of the time. When you look at naturopathic medicine, really the big core kind of guiding principles are, one, trying to figure out the root cause of the problem. Like, why is something actually happening? What is triggering it? What can be other reasons for it actually happening in the body? And that can go for anything. There's lots of different symptoms and things that can present itself. So it's trying to explore that. It's obviously trying to do, first do no harm. So trying to incorporate different treatment plans and things where it's going to be the least amount of harm or cause, as much invasion, keep that to a minimum as much as we can. Obviously, there are times for surgeries, there are times for medications and things like that, but generally there's lots of other supportive aspects that we can add in that can help. Also looking at the body's innate ability to heal itself and supporting that. There's lots of ways that the body tries to keep us in homeostasis or in balance. And it's always trying to use, the inflammatory process and things like this to actually heal us. So it's trying to help recognize those and support that as well. Mm-hmm. And a big thing with naturopathic medicine too is using things that are a bit more natural, obviously. So looking at botanical medicines, looking at supplementation, vitamins and nutrients and things that can be supportive if and when indicated. And doctor is teacher. That's also one of the huge principles. And I think one thing that I definitely take to heart, because sometimes I find that's more what I'm doing. I'm actually teaching my patients about their body, about what's going on, why they might be feeling these symptoms, what the blood work actually means, what, the reports mean, and how we can actually move forward in treatment plan, whether that includes the medications or referrals for further testing and things like that, or whether we can take a look at things like acupuncture and nutraceuticals and supplements to kind of support that as well. And really trying to get patients engaged in that process, because if we can empower the patient to take control of their health, I think that's so much more impactful long term, so that we can prevent some of this stuff long term down the road. So, yeah. Mm-hmm.
So do you prescribe pharmaceutical medications as well?
Yeah. So, and naturopathic doctors, we do have our prescription rights in BC. It's a limited scope. It's, I'm not prescribing, oncology drugs or some of the big guys that are protected. But, more and more I find people are, using naturopathic doctors as their primary healthcare physician or as like a family doctor, because, as you're probably well aware, in the Okanagan Valley, it's hard to find a family doctor. And because we can do, your physicals, your yearly exams, we can do pap smears, we can do prostate exams, we can order blood work. It's just not covered by MSP and the BC Healthcare, but more and more people are getting extended medical coverage for that as well, which can help. And then, yes, if and when I do deem it's necessary to prescribe certain medications, I definitely can. So, and I'm not against medications in any way. I just think that there's a time and a place for medications, and we don't always have to just turn to medications as the number one thing or first choice. I like to give patients options. But then there's other times where I'm like, nope, we got to go on this right now. Hopefully not long term, but, there's reasons and indications of why we'd have to start a medication from there. So, yeah.
Maybe you could tell us a little bit about depression. So it's a fairly common phenomenon in our culture today, in our society. What are some naturopathic ways to deal with depression when you see it? I know every case is different, but tell us some of the ways that naturopathy can help.
Yeah, it's a really good question, because obviously I think mental health awareness has increased, and that's been really great to see. And I think, a big thing to know is that when we see patients that come in, they may not specifically be coming in for depression or for anxiety, but I would say almost, this is just a stat off the top of my head, but maybe 7 out of 10 patients have something underlying, like they are dealing with some extreme anxiety, or they have had depressive states in the past, or they're going through some depression currently, which is obviously going to be important, because we're always taking a look at the whole body, right? It's taking a look at everything that's going on, from mental, emotional to a physical state as well. When you look in terms of some ways to help depression, I think one, it's looking at, well, what is actually causing it in the first place? Sometimes that can be mental, emotional. So looking at past traumas and different things that could be triggering that can be the important part to take a look at. Some ways that I approach it is always looking at the digestive system, because our digestive system, and there's a lot of research in this area right now that's showing that there's a huge link to our gut health, to our brain health, or it's kind of the mind-gut connection. So there's a lot of research in that area that shows that if we are not properly absorbing, if we're not properly digesting and breaking things down, and we don't have proper nutrition as a whole, that's actually having huge detrimental effects on our mental emotional health. One, it can be that, again, we can have decreases or malabsorption issues with certain vitamins and nutrients, which can be very important in terms of mood stabilization and increased energy and all of those things. But 2, you can see a big change in what's called the microbiome, or the bacteria that should be in our large intestine. We need a balance of the good and the bad bacteria. And if that's not happening or not the case, that can also have huge links in terms of depression or anxiety and things like that. So I see huge links in terms of the digestive system. So whether or not we go down something like food sensitivity testing, which is a whole other aspect that I could talk about for hours, that can be one place that we may start, because again, what they're seeing is that why it's so highly connected to our digestive system is that we actually produce and store our serotonin in our digestive tract. Serotonin is one of our main neurotransmitters that generally is the first one that's kind of indicated when there's depression and anxiety going on. The thought process is that we have a decrease in serotonin, which is why then we're seeing the depression and anxiety, because serotonin is like our feel-good, happy neurotransmitter that should be released and give us all of these feelings. Why that's connected to the gut is because we actually can produce and store about, well, I've seen varying stats on this, but it can be anywhere from about 70 to 80% of our serotonin in the gut, not in our brain. So again, if there's digestive disrupt there, chronic IBS, diarrhea, constipation, bloating, acid reflux, all of these different things that can be causing inflammation within our digestive system, and then we're seeing that we're not properly absorbing, that can have huge detrimental effects on even being able to build up that serotonin and store it. So, generally the first go-to is looking at SSRIs, or selective serotonin reuptake inhibitors. They're a drug that are generally the first go-to for depression and anxiety. But I try to take a look at other ways that we can actually help the body increase that serotonin overall. So whether it's neurotransmitter testing, the food sensitivity testing, and looking at other things that can also play into our mood and energy as well, which sometimes are things like iron and vitamin B12 and our thyroid health, because all of those can have huge effects on our overall mood and energy too. So again, there's lots of different ways we can kind of go about it, but that's some of the baseline. Really, that big connection with our digestive system can be key. Right. Yeah.
So this beautiful clinic here, I saw for the first time today. Well, I've driven past the outside many times, but I never noticed it. Tell us about this. How long have you been here? How many staff do you have? And do you have anybody with different specialties, or are you all doing the same thing?
Yeah, so with the clinic, so it's West Kelowna Integrative Health Center, we opened on the west side just after the May Long weekend of 2017. So we've been open for just over a year now. We are actually, this clinic specifically used to be one of the first walk-in clinics on the west side. So a lot of people know it already as a health center, but when we came to take a look at it, it actually sat vacant for about 6 years. No one had used it. They'd had some short-term people kind of in and out. And the first time I kind of saw it, I was like, oh no, I don't think we can do this, because it was really run down. There was carpet, there was 4 layers of wallpaper, there was holes in the walls. It was really dark and dingy. But then after seeing a lot of other spaces and blank spaces, I started to realize that the walls were here. It was already known as a health center, and we kind of just took it and brought it back to life, but brought it back to life in a new kind of integrated way. With the Integrated Health Center, there's myself and Dr. Michael Tassoni. He's our other naturopathic doctor here, and the two of us are the co-founders and co-owners of the clinic. And it's been about a 3-year process, basically from inspiration and ideas to actually physically being here today, which still seems pretty surreal. And I'd say both of us have a little bit different of a focus. We both have general family practices. So we've seen, I think our youngest patient is about 3 weeks old, and our oldest patient is 94. So we see kind of, the great span of ages for all different types of concerns. My focus is much more on women's health, all aspects of women's health, especially hormones, so hormone imbalances, thyroid hormone. Been working a lot with patients for prenatal care and also postpartum care, as well as fertility. And more I'm seeing lots of pediatrics, so lots of kids too. And then Dr. Mike, his main focus is actually chronic pain. Chronic pain and sports medicine is really his area. So he deals a lot with various reasons for chronic pain, acute pain, injuries, and does a lot of injection therapy techniques and other hands-on techniques that he uses and has a lot of success with, which has been really cool to see. So it's really nice that we can both really refer back and forth to each other, even if, a patient starts with myself to go through the initial visit and start seeing me for a certain treatment plan. I can always refer to him if all of a sudden they're in pain or they need a little bit of a different look at things. And same thing with him. They can always refer them to me if all of a sudden they get pregnant and he thinks that, I can have a bit more of a specialty care with them there. So that's been really great. And patients have really liked that aspect because we're both here for them in that kind of sense. We also have 2 registered massage therapists that work in our office. We've got 2 counselors, one being a registered social worker and one being a registered clinical counselor. And we've got a holistic nutritionist. So we're really kind of building a team of practitioners who are invested in the integrative health model, where it's looking at patient-centered care, where you build a team of practitioners around you that can help support you in where you want to go in your journey of health. And it's all about looking at optimizing health. So, even for patients who maybe they are feeling pretty good and they don't have something specific going on, like an acute condition or a chronic condition, if they're wanting to prevent that and optimize things and get them even just feeling better, digesting better, so that we can prevent certain things from happening later on. We'll see those patients as well. And it's again, really trying to build that team of practitioners that can help people get there. So it's been a long process, but it's been really, really exciting because we actually just expanded our team there. We also have 2 wonderful office administrators and receptionists as well, Amanda and Shona, who have just helped us enormously because for the first year, Dr. Mike and I were doing everything. We've been doing like phone calls and the emails and the faxing and the scanning and all the deliveries and the orders. And when you run a small business, you wear 30 different hats, right? Every single day. Yeah, it's great because you're your own boss and you can, set your hours, but your hours when you run your own business really become 24/7. So it's been a really busy year and a half. So now, and on top of that, we're doctors, right? And that's our main primary area of where we need to focus. Right. And the fact that we now have such a great team around us and people that are really supporting all of that has been really fantastic. And the community on the West Side has been amazing. We have been seeing so many new patients week after week when they find out that we're here, which has been amazing. And we have patients that span the valley. We have tons of patients, obviously, from West Kelowna, but Peachland, Summerland, Penticton, even as far down as Osoyoos, and some from Grand Forks. Wow. And then all the way north as well, obviously, with Kelowna and Lake Country, Vernon, and even further. So to see kind of that span across the valley and people coming to our health clinic, because to get kind of a different approach to healthcare and the care that we offer here has been really cool to see.
Yeah. Mm-hmm. So yeah, it's like a joke. Being in business for yourself is great because you get to decide which 18 hours a day you're going to work. Right?
Yes, exactly.
So are you still taking new patients? And if you are, tell us the easiest way for people to reach you, a phone number or website.
Mm-hmm. Yeah, so we are accepting new patients all the time, both myself and Dr. Mike, our registered massage therapist, our counselor, and our holistic nutritionist. Everyone's accepting new patients, which is great. Generally, in terms of the booking process, people can actually book online, which is nice and easy. People have been loving that. Our website is westkelownaihc.com, and there's a little book online there where people can actually go on and create a little profile and manage that, which has been great. Or you can give us our office a call as well. And either way, we can get you booked in terms of the services. Generally, with the first appointment, specifically with myself and Dr. Mike, it is an initial visit. So it's a little bit longer than your typical medical appointments. It's about 75 minutes long, where we'll go through kind of your full health history, potentially do some focused physical exams, and then talk about any testing or blood work or diagnostic testing that might need to be run. Or obviously, if patients have had x-rays or ultrasounds done, getting those reports back so we can actually review everything before moving forward with treatment plans, because a big thing with naturopathic medicine as well is it's individualized treatment plans. We could see 10 patients come in for headaches and treat all 10 of them very differently, because everyone is going to have different things that they react to, and everyone's different, right? That's why when people take medications, there's like 300 different side effects. Right. We all process those things differently, but that's the same with natural things too, and not all supplementations and things are going to be right for everyone. So it's figuring out for each patient what's going to be the best course of action, and making that very individualized. So whatever people are looking for. The other cool thing that we have here actually is an IV lounge, so a vitamin IV lounge and a booster bar. So we do a lot of customized vitamin IVs, which is great, and booster bars. So we, a lot of people talk about vitamin B12 shots. That's our booster bar, but we have varying different types of, we call them boosters or injections that we can do for various different things. So whether it's energy or needing adrenal support, or kind of maybe calming us down a bit, and how we can support that, we can actually do that really well. And patients don't necessarily have to go through the full initial visit process to have access to that. And our vitamin IV lounge has been very busy, which has been nice to see. We usually use that kind of as an adjunctive to everything else that we can do for the patients as well. But it's looking at high dose vitamins and minerals and amino acids that we can actually get into the system directly by bypassing the digestive system at a much higher dose than you'd be able to get at orally. And patients have seen a lot of benefits from that too. So that's definitely something else that we offer here, which is a little bit different than some of the other clinics on the West Side.
Do you take any of the treatments yourself at the booster bar?
Yes, actually. And that's actually something that's really important, and something that we try to foster here is that, while we are a health clinic and being in healthcare, it takes a lot of time, a lot of energy, taking care of patients. And it's something that we don't take lightly, but we also feel like we need to take care of ourselves too, right? You can't give from an empty cup, right? So we are constantly, and that's the nice thing here. So I actually just had an acupuncture treatment the other night on myself, which was really great, because I was having some tension in my shoulders and in my neck, and that has completely cleared that up, which is good. Dr. Mike and actually all of our practitioners here, we give each other, or we will go into the IV lounge and do IVs. Specifically, I find it's either kind of before long weekends or after long weekends, kind of when things have been so busy, and it's nice to kind of boost our levels before that. And yeah, the nice thing is too, is if we need a quick B12 shot, we can always do that as well. So it's nice to, you know, if I need to block off an hour and go get a massage, I've got that right here. Or if I need to get some acupuncture, I've got that right here too. And we try to foster that with everyone as well. We think it's really important that you got to take care of yourself when you're always taking care of other people. And so we're pretty lucky to have those services kind of at our fingertips. So,
right. Yeah, I like the concept that you're willing to try various treatments before having other people do them. That's pretty cool. Yeah. So who would you like to nominate, Dr. Lauren, to come on the show in the future?
That's a really good question. I've met so many cool and interesting people in Kelowna, and it's really been in these last 2 years, especially when we've opened the clinic, that has just grown. It's been such a cool community to get involved in, especially on the west side and in Kelowna, and even just kind of spanning the Okanagan. The person that I would like to actually nominate is Tracy from Lux Camp. And have you heard of Lux Camp?
No.
Okay, you got to go take a look at it. She is amazing. She's an absolute wonderful person. And we've become quite close friends. And she's been so supportive of both myself and Dr. Mike and our business since we've grown. And she's really been one of those key people who has opened up her arms to me since I moved here and introduced me to so many great friends and other local business owners since I've moved here, which has been really nice to see. And she owns and runs a luxury tent company. So it's these beautiful tents that you can actually rent in terms of camping or stay-at weekends or weddings. And she actually just got a new bowler into the fleet as well. So a bowler is one of those really cool vintage kind of campers. They're like a very specific type of camper. Yeah. And I just find her fascinating. She's so supportive. She's community driven, and she's one of the hardest workers that I know. She's also a teacher as well. So she keeps herself very, very busy. And I just love what she's doing. It's kind of like bringing people back to nature, disconnecting and unplugging, but then connecting with those who are around you by, you know, sitting around a campfire and chatting and getting back into nature with the kind of the camping features. But it's a very kind of glamping experience, which is nice too. So I would definitely check her out. She's great.
Tracy's last name? You know?
I do. I just never know how to pronounce it right. And she told me the other day, and I just don't want to botch it. But I can give it to you. She's going to laugh when she hears this because she literally spelled it out for me. But I'll give that information to you.
No problem.
Yeah.
All right. Well, Dr. Lauren, thank you so much. I've learned quite a bit today about the healthcare field and your amazing clinic. I didn't know any of that until I came in here. So we'll certainly help promote your business, and I want to thank you for your time today.
Yes, thank you so much for having me. It was great.
Luke Mankus is a realtor. He loves what he does. We asked Luke if he had any regrets about moving here in 2011, and he always says, yeah, one regret, and that is he didn't move here sooner. When Luke came here, he didn't know anyone. He didn't know the neighborhoods or anything or anyone besides his daughter, who was 6 years old at the time. So he knows what it's like. Now, he's an expert and has helped well over 100 single people, couples, families, and investors with their real estate needs in the Okanagan. If you're new to our beautiful city, Luke can help you get connected with great lawyers, dentists, carpenters, landscapers, swimming pool installers, you name it. And whether you're new to Kelowna or not, Luke knows real estate. He can help you find a great property, negotiate a good deal, and hold your hand all the way through the process until the day you get your shiny new set of keys. Luke is known as a no-pressure kind of guy. He's had clients where it took even a year or more to get them into a property. He just doesn't believe in rushing things. On the other hand, when you decide it's time to act, he's diligent, and he'll work day and night until the job is done. Give Luke Mankus a call or a text message at any time, 778-215-4273. Again, that's 778-215-4273. 778-215-4273 to chat with Luke about real estate.